I'm Dr. Steve Rudnick. I'm the Chief Medical Officer of Noble Physicians. I'm here to talk about a recent article in the British Medical Journal that references a small study that was done in Norway where it was noted that there was a higher mortality amongst terminally ill patients that were receiving the COVID-19 vaccination. I think it's important to consider the population that's being vaccinated when you're looking at any of these studies, and you have to take these things with a grain of salt and allow for the larger data sets to be crunched over time. When you're talking about terminally ill patients, of course, you're looking at a cohort of people that are going to die, presumably in the near future, and it would be important to consider their clinical condition before giving the vaccine. One of the concerns was that the Norwegian physicians were advised to give careful consideration to their patients before offering them the vaccine. There have been studies back in previous decades with influenza vaccines amongst terminally ill patients, and it said that those same patients would benefit potentially from influenza vaccines, because getting influenza at the end of your life could be a terminal event when you're already frail and at risk. The same goes for COVID-19. In the patients that are most vulnerable to the side effects, for example, if they've had previous reactions to vaccine components, of course, those would be the folks that we would be holding off on giving them the vaccine. And I just wanted to take a moment to point out that it's always important to interpret these results carefully and allow for larger studies to help us determine what the best recommendations would be for the future. For now, suffice it to say that it's still thought that the vaccine is safe for the vast majority of the population, and this also brings up another subject of herd immunity. I've still been receiving some comments from my patients and colleagues about the idea of herd immunity. Some have quoted the efforts in Sweden to allow for a natural progression of the coronavirus amongst their population, and the result was, unfortunately, there was a higher rate of viral infection, a higher rate of hospitalization, and a higher rate of death compared to any of the countries nearby. As has been mentioned before, it's thought that about 1% of the population who has the coronavirus would die from this disease. And if you're looking at a country the size of the United States of more than 350 million people, that would be about 3.5 million people. As we approach 500,000 dead in this country, if we were to vaccinate just with the available vaccines offered by Moderna and Pfizer, which have about 95% efficacy, that would leave about 17 million people exposed to the risk of death, and about 1% of those would be 170,000 people, which is a much lower number than 3.5 million. I'm appreciating the questions that I'm receiving through my social media and through our office from patients and from colleagues. And if you enjoy these videos, please like and subscribe. See you next time.